Hello, Mary Beth. Welcome to Lyme Disease UK. It's such a pleasure to have you here.
Thank you so much for having me, Sarah.
Um, Before we get started, I'm just going to introduce you in case for anyone who doesn't know you. So, Mary Beth Pfeiffer is a graduate of Marist College and has worked at the Poughkeepsie Journal in the US since between 1982 and 2015. Her investigative reporting is often long-ranging, meaning she writes a series of articles over many months. She's been investigating Lyme disease since 2012, and the journal has published more than 12 instalments on the subject. She's just published a new book called Lyme, the First Epidemic of Climate Change. So, as I say, welcome. You've got
I'm
it
doing a
there.
little show and tell here.
Brilliant. So for anyone who hasn't seen in the group already, Mary Beth has kindly donated a signed copy of her book. So if you haven't applied to win that book in the prize draw, please do pop into the group and check. We'll be drawing that in a few days. I can't remember the deadline. From memory, it was the 4th of April, but do go and check.
Okay.
Wonderful, thank you. So I guess a good place to start really is, what sparked your interest in Lyme disease? Where did this all start from?
Well, I live in an area of the world that may, in fact, have the highest Lyme disease rates per capita, the Hudson Valley of New York. I actually got a database of case counts and did an analysis for the entire United States and found that for the top 10 counties in the United States, there are 3,000 counties, 5 of the top 10 were Hudson Valley counties. Wow. So I had known about Lyme disease for a very long time. If you live here long enough, you hear stories of people who have had it. I had it twice. It was pretty quickly diagnosed and treated. I was one of the lucky ones. But it was sort of on my list as an investigative reporter to look into at some point. And I wish now that I had looked into it sooner, because the things that I found, frankly, shocked me in terms of a huge patient population that was clamoring for care. People who had gone to 10 and 20 doctors with late-stage advanced Lyme disease, who may have been treated or may not have been treated quickly enough, but who could not get doctors to recognize that they were in fact still ill from Lyme disease. So one thing led to another, of course, and I got into the tests for Lyme disease, the research on how to treat it, the treatment trials. We can talk about those things, but in short order, I found that there were many investigative stories and investigative paths for me to go down. And so I did. And here I am 6 years later, having written a book that I think puts a lot of the research that I did over time and the Lyme picture itself into a global environmental perspective. It's sort of a what's wrong with this picture look at Lyme disease.
Thank you. I mean, I have to admit I was similar in that when I first entered the Lyme disease world, I was shocked myself. I had no idea at just how bad, I guess, the situation is, and how you could have something that just I didn't realise a disease could be as controversial as this, I guess, is a simple way of putting it.
Yes, it was the controversy that I was unaware of. And I think the reason that I was unaware of it and that many people who have not been touched by this disease are unaware of it is because of the way Lyme disease has been framed in American medicine. And because of the power of American medicine, it's the way it has been framed around the world. We can diagnose it. We have a test that works. We can treat it. We have drugs that work. The antibiotics kill the Lyme spirochete. We know that there's plenty of evidence to seriously question and challenge those assertions. But those assertions are part of the medical dogma, the medical literature. They've been repeated over and over again in reviews in the literature, despite the fact that there's a heck of a lot of research, and I cover this in my book, about the failures of the tests. and the failures of common antibiotics to break through, and the reasons why they don't break through the very persistent Lyme infection. But because the CDC and the Infectious Diseases Society of America, which wrote the guidelines on Lyme disease, have such a hold on the disease and have such power over the message, these other counterpoints have had trouble breaking through. Mm-hmm. I am hoping my book will help them to break through. Should it be successful? Should it get into enough hands? I'm trying to reframe the way Lyme disease is seen and handled and managed in the United States, and hopefully that'll spill over elsewhere.
It's so important. It's absolutely right that message has, and you can't blame your sort of general practitioners that are treating many different conditions, that they kind of believe what they're told, because you'd hope you would be given the right message. So in many ways you can't blame the individuals, but the big picture is frankly scary.
Yes, the primary care doctors need these shortcuts. They need to get the message quickly, because they don't just treat Lyme disease, they treat many things. So they're told, okay, rely on the tests. The Lyme disease guidelines clearly say you must have a rash or a positive test to diagnose Lyme disease. Let's take the rash. The most comprehensive data that I could find was a study of 150,000 cases that were reported to the CDC. And as you probably know, these have to be the very best cases to meet the CDC threshold of Lyme positive. Okay, of those 150,000 cases, 70%, 69.2%, I think it was, of those reported the Lyme rash. Mm-hmm. That's 7 in 10. Mm-hmm. All right, best case, 3 in 10 don't have the rash. Mm-hmm. There are also many rashes that aren't seen, that aren't recognized as Lyme rashes because they look a little bit different. They don't have the central clearing, which is the classic bullseye. They may look blistery. They may appear in several places. Often I hear that they are taken for spider bites, even by doctors. So that's one way that we know that Lyme diagnosis just falls down on the job. People with rashes don't see them. They're not recognized, whatever. Then go to the test. Okay, we have to have a test or a rash. But the test, it's been defended for years and years by the CDC, by the IDSA. Okay, the first thing they say is the tests work, except if you use them too early. Okay, that's when, we know something like 40% are correct. Okay, that's when you use the rash. Okay, we know the rash doesn't work sometimes, though. So basically, the philosophy is you have to wait. If you don't have the rash, you have to wait. You have to let the Lyme spirochete disseminate through the body and then test later. And the studies show, yes, in fact, the test improves later on. But it's not perfect. In something like 13% of neurological cases, it still is wrong. That is a huge share of people who are not diagnosed, not treated. But the other thing is, this is not one disease that you want to fester. You don't want that Lyme spirochete getting loose in your body. You don't want it hiding in cartilage. I mean, it very quickly leaves the bloodstream and goes elsewhere. And that's why it often can't be found in tests, in culture tests, for example. We don't have a good culture test at all. And we know the damage it can do. We know the way that it changes forms, becomes these little round bodies. It hides under these protective coatings called biofilms that classic antibiotic drugs cannot penetrate. So this whole idea that we have to wait until the tests get better is flawed, and it's very harmful to patients. And I think it's responsible at the heart of the problems with Lyme disease, that we can't accurately, quickly diagnose it.
We desperately need better tests.
Mm-hmm.
It's critical.
Without question.
And I guess this might be a simple answer given what you've talked about and how much you found. But I guess what prompted you to actually turn your research into a book?
Well, I retired early from the Poughkeepsie Journal in 2012. I had done a lot of work on Lyme disease, and I was fully invested in it. I believed what the Lyme patients were telling me, not just because so I basically wanted to write a book when I left, and I had to figure out what the best approach would be. I didn't want to write another book on chronic Lyme disease. Those words are so incendiary and so controversial. And there are other books out there about chronic Lyme disease. I wanted to put it in a larger perspective. So I started to do more research. And climate change was one thing I hadn't touched on at all. But that was sort of my aha moment where I said, wow, this is a way to introduce Lyme disease and its many, many travesties and threats to the general public in a way that can be understood to people outside the Lyme community. I mean, after all, climate change affects us all. It's something we are responsible for. It's a very big and politicized environmental issue. So I thought if I put it into that perspective, that we're all in this together, that we're all responsible for this, that the threat is very real. And then if I, discussed at length, which I do, the problems that patients have in getting treatment for this disease, it makes that whole picture all the more relevant. So, as I said, that was sort of an aha moment. I can kind of take this outside of just, and I don't mean to minimize the Lyme community, because we need to involve other people beyond those who have already been infected and affected by these terrible diseases. We need to bring in the rest of the world. So here I am. And I'm hopeful that it may break through. I've had 3 reviews now, and all of them have been very good. And all of them, to just, to tell you how I viewed these, they believed me. They believed the science that I put out there. They believed that I made a very good case, as one of them said.
Yeah, and it's so important, as you say, the Lyme community already knows the problem. We're already sick or have been sick and understand the risks. And it's partly why I do what I do. Anything we can do to stop more people getting sick, and if they do get infected, to get early treatment is absolutely key. We need to stop this problem getting worse.
Yes. And the risk is particularly bad in places where the disease is emerging. Places like the UK, Ireland, Canada, where the primary care doctors don't necessarily know much about it. And they're just going straight on the literature that it's easy to diagnose and easy to treat. Mm-hmm. That is, if they even think to look for it. Mm-hmm. Because when the numbers are very low, they don't think it's there. Mm-hmm. I'm going out to California to give a speech there in Northern California to a Lyme disease group. And I've looked into the research in California, and, I've heard several times there's no Lyme disease in California. And I'm sure you've heard there's no Lyme disease in your area of England or Wales or Scotland, what have you. And it's there. We know it's there. The problem is it's under-recognized, it's under-reported, it's under-diagnosed.
Absolutely.
Yeah.
Absolutely.
One of the serious problems that I came across when I was looking into the problems of the tests is what I call one of the myths of Lyme disease, is that it's overdiagnosed. And this is a message that was disseminated to doctors from the early 1990s through the 2000s. I found in the medical literature 30 papers on Lyme disease overdiagnosis. And it was based on taking samples and tests results and then retesting them. And lo and behold, the very first test that found that study found that among these retests, half of the tests that were positive in one lab were negative in another lab. Now, one could kind of conclude that we don't have a very good test if that's what happens, that we have this inconsistency in reporting. But instead, this was taken as a sign that we are tagging too many people with Lyme disease and treating them with antibiotics, and we got to stop doing that. So the warning went out in these 30 papers and reviews of the literature that people are overdiagnosed and falsely diagnosed. Now, I would say that, one, there probably are people who have been falsely diagnosed. I did not find much in the literature, if anything, of harm that was done by that people who were treated with a month's worth of antibiotics suffered, terrible drawbacks. We do know that there are risks of antibiotics. They should be used judiciously. But on the other side, this is one of the safest drugs there is, the class of antibiotics. I could find only 5 papers on underdiagnosis of Lyme disease. And we all know what that leads to. That leads to very, very serious neurological disease, to cognitive functioning problems, to intense fatigue, to pain. And there's just been very little concern or care for people whose diagnoses are missed. Part of the myths of Lyme disease.
Absolutely, absolutely. And if we go back to sort of the title of the book, does that suggest that climate change is actually causing this epidemic? Is that what your research found?
Yeah. No, I do not suggest that this is the cause. Mm-hmm. That we do know that climate change is moving ticks around the planet, that they can live in places they never could before. I was reading a paper earlier this morning about a group of people in the Arctic region of Siberia, pretty far north. Mm-hmm. And they tested 77% of them for Lyme disease, and they found that 10% had antibodies to the Lyme spirochete. How did that happen among this group of people who are very far removed from, the endemic concentrated areas of Lyme disease? We know that ticks are turning up in, northern Sweden, and that they're moving into Canada. Canada is a new frontier for Lyme disease. We also know, though, that white mice are moving north into Canada. So basically, the environmental kind of pieces are being put together to enable this movement. But Lyme disease has been around for a long time. We know that 5,500-year-old mummy that was found in the ice in the Alps 20 years ago had Lyme disease mm-hmm. in his system. Mm-hmm. And by the way, he was carrying a little satchel with a fungus that was known to have antibiotic properties. Isn't that interesting? And he might have been treating himself for the effects of Lyme disease. We also know that ticks have been found in amber, 15 to 20 million years old in South America. And lo and behold, they put these ticks under an electron microscope, and they could see little tiny corkscrew organisms inside the body of this tick, which they believed to be the Lyme spirochete. So it's been around for a long time, It's kind of been a very silent presence, though, for the most part, which we have not really had a serious threat from it. And now it is emerging because all of those environmental factors have come together to support it and to move it around the planet.
Mm. Mm. And how long did all of this research take you for the book then? I mean, obviously, all the way back since 2012, did you start?
Mm-hmm.
Yes.
Mm-hmm. Yes.
But
I did do some reporting in those first couple of years on other things as well. As an investigative reporter, I've touched on a lot of issues and topics over time. But the book itself, after doing my long, extensive series for the Poughkeepsie Journal, probably took about a year and a half to 2 years to put together. And that final year of writing the book was very intense, of trying to pull together all these threads. How did this kind of tapestry look, or what were the various components that it was made up of that enabled me to draw conclusions about Lyme disease? And my book goes further than my reporting did, because that's what an investigative reporter does. I build on my base of knowledge. I learn more over time. I make more connections. And the connections I made, beyond knowing early that it was a bad test and there were people in need, was that mainstream medicine had missed the boat on Lyme disease, was refusing to accept that the medical, the research community was saying, okay, this can be challenged. And I felt the need to do something about that.
Such a lot of work, and it seems like you found an awful lot of answers as well. Was there anything that any of the questions that you kind of had in your mind about Lyme disease that you weren't able to get satisfactory answers for?
I guess one of them is, and people ask me this a lot, well, why won't the CDC and the IDSA accept that there's another view of Lyme disease? And I don't have a good answer for that. I do know that they believe what they have written in their many articles. I know that they have done science to support their beliefs and their views. But what I came to conclude, and this is, I guess, a theory that I'm working on, is that they IDSA researchers, they share the same beliefs and they reinforce their beliefs among each other. I think it was sort of summed up for me in a group of emails that I got from the CDC. I actually got a sheaf of 3,000 emails that I read through, or 3,000 pages rather. And back and forth, there were IDSA folks on there and CDC folks, and it was all about often how we have to fight against these people who are out there spreading this nonsense about Lyme disease. And they have great power. It's like they had exaggerated the power of the Lyme community when, in fact, they held so much of the power. But one email in particular really struck me. And it basically was someone in the National Institutes of Health writing to someone in the CDC, both people who had managed the issues pertaining. I'm done, I'm moving on. But there's just one thing I will not miss, sorry. He was saying there's one thing he would not miss when he retired: the Lyme loonies. So that, that phrase itself kind of tells us, we have a corner on knowledge and everybody else is crazy. So maybe that's it. That's why they held on to it. That's why they clung fiercely to this view, because they believe it and everybody else is wrong. And they all reinforce each other. And they obviously reinforce each other in the medical literature with reviews that say the same thing over and over again. There was a European review that came out about 2 weeks ago. One of the authors is very closely allied with the IDSA. And he repeated the tests work, the short-term antibiotics work. I wasn't surprised at that. But what I was surprised at was there was no mention at all of the new research that is coming out, which is showing that common antibiotics may not kill the Lyme spirochete.
Yeah. Do you think fear perhaps plays into it? I mean, I understand some readers have told you that they feel afraid after reading your book. Could that be part of it for this? And I guess, was that the intention when you wrote the book? Were you intending to use fear as a vehicle for change?
Well, I don't want to scare people so much as I want to inform them and warn them. And if this scares them, so be it. It probably should. There are ticks all over the place now. In many places, they weren't just 5 and 10 and 20 years ago. We know they're moving rapidly. They're in twice as many U.S. counties than they were just, 20 years ago. They're also appearing at strange times of year. I took a walk in the field across the street from my home. I live in the country. The day after Christmas a couple of years ago. And it suddenly had gotten very warm in the 60s Fahrenheit, which is pretty warm for that time of year. And ticks had just exploded. I had 3 dogs with me on that walk, and we picked off 21 ticks. Now, that kind of thing to happen in winter had just begun, in New York State, of all places, was unheard of. So, yes, I do want to kind of wake people up, and if it makes them afraid, maybe that's a good thing.
Yeah. And there are things that we can do to take prevention methods, and so maybe raising this awareness, it's so important. But it seems that despite the fact that it infects millions of people around the world, other than yourself and a few others, it really does have such little media attention and funding. I mean, even compared to something like Zika that infects so many less people. Have you any idea about why that is and what we can do?
It all goes back to the power of the people in America who have determined how Lyme disease will be viewed. Reporters, just like primary care doctors, are very busy. And they don't have time on deadline when they're given a quick story to do on Lyme disease this season and what the trends are and how many ticks are out there to figure this out. So they go to the U.S. Centers for Disease Control website and they see in the world. So it's pretty difficult for a reporter on deadline to just say, that picture's wrong. I have to take what these folks in a local Lyme advocacy group are telling me. There's an imbalance there between the New England Journal of Medicine on one hand by these other messages and this other information that has been out there for way too long.
Mm. And I guess you interviewed a large number of people for this book, scientists, doctors, patients, and it sounds like from varying different viewpoints as well. Is there a particular conversation or story that stands out to you?
There are many patient stories that do stand out to me. The emotions that I was exposed to of mothers trying desperately to get care for their kids, being told that there's nothing wrong with the kid, or it's in your head. There have been suggestions that mothers are inflicting this, constellation of symptoms on their children. I spoke to mothers who had been reported to Child Protective Service authorities. Um, the mothers really stick with me. And I tell the story of a boy named Troy, an adorable kid. And he had Lyme disease, and he'd been treated briefly, and then he got very sick. And he got sick with some pretty classic symptoms of Lyme disease. He had headache, he had fevers, he had intense fatigue, couldn't get out of bed. He was dragging his foot behind him. Gait disturbance, it's called, when it's applied to Lyme disease. So he went to the hospital. He was put in the hospital because he lost so much weight and he basically could not function. He stayed there for a week, and at the end of that week, he was diagnosed with something called pain amplification syndrome, which means it's in his head. They gave him prescriptions for 2 antidepressants. One doctor even called this schoolitis. Now, this is something I hear all the time. This is typical, unfortunately. Mm-hmm. It's in their head. It's in your head. Mm-hmm. You have depression. Mm-hmm. Okay. The upshot of this story, the punchline, this happened in Connecticut, the place where Lyme disease was discovered, quote unquote, in the late 1970s. This happened where doctors are well aware of the impact, or at least the numbers of cases of Lyme disease. He also went to a top hospital for care, and nobody wanted to hear a word about Lyme disease. This is unconscionable. And the problem is, and part of the reason, or the reason why they didn't want to consider Lyme disease, was because this child was way sicker than they would expect. Serious, very debilitating disease.
Absolutely.
Yeah.
I mean, you must have found this very emotionally challenging to write the book. How did that impact you?
Well, I do take to heart, what people tell me about their children and their stories fighting against the system. But as an investigative reporter, you use that. You channel that into energy to get something done. And the book is not only stories of people who have struggled with Lyme disease. I didn't want it to be just anecdotal or just dramatic sort of horror stories. There are some of those in there. But this is a story about a disease, and a disease that's moving, and a disease that's growing, and a disease that has been terribly minimized. That's the key thing. We've just made it out to be this little nuisance disease that can be treated, and there we go. You're on your way. When the Lyme vaccine went before this committee of the CDC, and these committees basically review all the literature, and they grade the vaccine, and they say, are we going to give it the highest recommendation, namely that they strongly recommend its use, Or are we going to say, just, take a look and maybe decide if you want to use it? It turned out it got that second level, not the highest, which is very, very unusual. And just before that happened, a Duke University pediatrician had stood up and said, this is as yuppie a vaccine as you'll ever see. He had gotten the message that this is just a minor problem of affluent people. And, I have encountered the same thing in researchers who have tried to get grants to study Lyme disease. They are told, one told me in particular, it's a middle-class disease. They are told, another told me, well, we have a vaccine for that, so there's no problem. We didn't at that time. It had been pulled from the market. They are told, and this is another thing that a researcher was told in rejecting a grant, there's no such thing as chronic Lyme disease. Those are the kind of poisonous words that are out there that have really just framed this disease in a way that's, very destructive, which is why I didn't want to concentrate just on that, but again, to give it a bigger perspective. The other thing I'd add here, Sarah, while we're talking about those words, chronic Lyme disease, the little boy I told you about, Troy, they've had to take him on occasion to the hospital for this and that. And, I've been told by other mothers, one in particular in Australia, we never mention that my daughter has Lyme disease because it's just, it's so controversial. So they told a hospital doctor in the ER that their son was treated for Lyme disease and that an outside doctor believed he was still suffering the effects of Lyme disease. And the hospital doctor wagged his finger and said, there's no such thing as chronic Lyme disease. And he added, these so-called Lyme specialists, all they want to do is take your money. They're a dime a dozen. And, it's those doctors who are the ones who are out there trying to solve a medical problem, a very big one, without much help from mainstream medicine. They're the ones, I've talked to many of them, interviewed many of them, had them teach me the ins and outs of what they're doing to deal with this disease. They're the ones who are putting their licenses on the line. They're often criticized because they charge a lot of money, and they do. And, part of the problem is they cannot be reimbursed by insurance. They don't want to be part of the insurance system because they might be flagged, and some of them have been flagged by the insurance companies and reported to the medical overseers. But these are the doctors, by and large, who are trying to figure this out when nobody will, who are trying to care for a population that nobody wants. And, they're stigmatized.
And I just wonder what that doctor would say when presented with the people that are treated and do improve, do get better. The people that have got long-term symptoms and they've been put down to psychological problems or whatever. I mean, perhaps they'd just say it was a placebo effect. I don't know. But it seems like there's just too many people that do improve on treatment and do get better.
Yes. They do say placebo effect. And that is in the literature, that people get better when they get antibiotics or a placebo. But the medical literature also shows that the people in those twin kind of arms of the treatment trials, by and large, got better at a higher percentage than the people who got the placebo. Which brings me to the flaws of the trials. The trials, and there's mainly 4 of them, from 2001 to 2008. And they mainly employ the same strategy, the 3 months, the partly intravenous, partly oral, and they haven't tried anything else. They have not looked into the interplay of co-infections. Do we even know if these people had other infections, which we do know, Babesia for one, makes Lyme disease much worse and more difficult to treat. But those studies have also been critiqued and criticized as being small or underpowered statistically, meaning the way that they were set up was kind of guaranteed to underestimate their good effects. And even one of the people, Dr. Brian Fallon, who did one of those trials and wrote up his results, has said that his findings were underestimated relative to his bad findings, namely that there were some drawbacks to treatment, have been underestimated relative to the benefits. So just getting back to, what do they say about these folks who get better on antibiotics? The research hasn't been done properly, and not enough research has been done to find out what works for Lyme disease. They just keep doing the same thing over and over. And that's what the Dutch group did in March of 2016, somewhere about that time. That's what they did. They just repeated the same kind of stuff that was done earlier with the 3 months and so forth, and they came to the same conclusions. And it's no coincidence that their conclusions were published in the New England Journal of Medicine, because it reinforced what NEJM has long said, and it fit perfectly into their little puzzle piece of Lyme disease, but it left unanswered a great many questions.
Yeah.
And there is in the medical literature studies showing that people do get better with extended courses of antibiotics. Dr. Sam Donta in Boston did a study of his patients. It wasn't one of those placebo-controlled, double-blind studies, but he found in a pretty large segment of people who were treated on average for 4 months that a large number, I think maybe 2/3 of them, got much better. 15 to 20% got somewhat better, and the rest didn't. That kind of research has just been brushed aside as not filling the requirements of placebo-controlled double-blind. But it's out there, and we just it suggests some other picture of Lyme disease treatment that we need to explore in greater depth.
Absolutely. Surely, if nothing else, it flags up the need for those proper trials to be completed.
Yes. Which also raises the question of money that's been devoted to this issue that we haven't discussed. I would imagine, to ask you a question, that the situation is similar in the UK, that there isn't a lot of money devoted to this.
No, not to research and not to awareness either. And I think that in some ways, given that there aren't answers from the research in how we should treat this, there's just a lot of information about what doesn't work.
Yes.
I can sort of understand not knowing or not being able to give doctors clear guidance on how to tackle long-term cases or complex cases, but I cannot understand on any level why you wouldn't raise awareness with people that aren't yet ill when you know that there are people becoming very sick.
Yes, in New York, we have a bill pending in the legislature. It's been kicking around for a while to put up warning signs, at every nature trail, in every park. And there are some, we do it, but in a haphazard, not coordinated way.
The same here.
And the problem is that very little money has been devoted to this. The National Institutes of Health have given Lyme disease about $24 million every year for the last 10 or 15 years. Hasn't changed. And it is far less in proportion to other vector-borne diseases. West Nile virus gets something on the order of $7,000 per patient per year. Lyme disease gets $133 per patient per year. And that, again, goes back to this perception that West Nile has a fatality rate, and Lyme disease doesn't really kill people. And the truth is much, much more nuanced and misunderstood. We know that Lyme disease does kill people. Certainly Lyme carditis has been acknowledged, and those cases are counted. But those are probably the only ones that are truly counted.
Mm-hmm.
There are many Lyme suicides.
Yep.
There are Lyme deaths from complications of the disease, and that's how it's recorded in the literature, in the records.
Yeah, it's recorded as sepsis or pneumonia or whatever. And for those, and also though, even if it isn't a fatality, it's significantly life-changing for many people. It isn't acceptable to have somebody who's housebound or bedridden and can't go to school if they're a child or can't work if they're an adult. That isn't a fulfilling life.
No. And, my sense is, here in the States at least, that more and more people are aware of the extreme cases of Lyme disease. This is a good development, unfortunately. But the more people I speak to in New York and in the Northeast, and even when I go to New York City, where a lot of people have second homes upstate or know people who do, I hear stories. Yeah. I hear, my mother-in-law, never got over it, and she couldn't walk after a while. I hear of kids leaving school for several months at a time. And so people are aware there's a lot more going on here than we understand. They don't know the reasons for that. They think that case they're hearing about, well, maybe that's sort of an exception to the rule. But it's a very big exception. In other words, it's a very big population of people that are suffering these effects of Lyme disease.
Yeah, even if it is a minority, it's a significant minority.
Yes.
And we don't know, do we? We don't truly know how many people are affected.
Mm-hmm. And one thing I'd also add about that, when I was doing my book, I'd ask people for endorsements for my book. Would they read my book and give me a nice quote for the cover? And a couple of the answers came back to me from their assistants. I had a terrible case of Lyme disease. Yes, I will give this to my boss. Twice that happened. And then the cover of my book was done. And I just thought it captured so much about the disease. I'm just going to show it to you again.
Yeah.
It's just sort of menacing.
Yeah.
This deer and the very, very large Lyme letters sort of growing up out of the foggy landscape. So I wrote to the designer. I got his name and I thanked him. And he said to me, I had a monster case of Lyme disease. It lasted several months. I had the facial palsy. I was very sick. So he had a personal experience that was reflected in that book cover. He, by the way, had also designed the cover of the book of Alec Baldwin, the actor, who plays Trump on Saturday Night Live, to very, very great, degree and effect. And he did his book as well. There are a lot of people out there who are now experiencing this. As one of the Lyme doctors, Dr. Stephen Phillips, says, you don't get it until you get it.
Absolutely.
And there are people in Congress who are getting diagnosed with Lyme disease or whose families are getting diagnosed. That doctor, Dr. Phillips, he says he has treated about 100 doctors who have Lyme disease.
Yeah.
He said the problem is many of them don't take my treatment modality back to their practices because they won't treat Lyme long term.
Yeah.
Because they will risk their licenses because they may get into trouble.
Yeah. Yeah.
These are the things we need to change. And to me, this is the message we need to get out there to the bigger world. Absolutely. Beyond the Lyme community. So I hope people will buy my book.
Yes, well, we'll certainly share well, we've already shared the details in the group, but we'll share the details when we put this interview on our website. So yeah, absolutely, the word needs to get out there.
Yes.
And I guess we've talked a lot about how bad the situation is. Do you have hope? Can we resolve this epidemic?
I do have hope. It's hope that is kind of tinged with a little bit of apprehension because we do have a long way to go. The message isn't getting through quick enough. Here we are 24 years after the test was adopted, and doctors have no other choice but to use it to diagnose. But that said, as I said, more and more people in positions of power are being diagnosed with Lyme disease. They're getting the message. There is research being done on new tests. I believe there is a consensus that we need a better test. Even though it's still being defended, it is out there. And there's a lot of research being done there. There are nonprofit groups in the U.S. that are putting a lot of money up to fund that research. They are filling the void that has been left by government and medicine. So I'm very hopeful about that. There also is research being done on an anti-tick vaccine that largely is happening in Europe. The Antidote Project, it's called. And I really hope that is the first vaccine that breaks through and is approved, because other vaccines, while they may be a little closer to fruition, will only act against Lyme disease. We need a vaccine that will act against all the diseases that ticks carry, and namely, it will act against ticks. It will detect that tick saliva, and it'll fall off or it'll be killed. That's what I want to see happen, so that we don't have to deal with Babesia and Powassan virus and Bartonella and all the other things that are known and unknown about what ticks carry. Absolutely. But in the meantime, we really need to arm ourselves and prepare ourselves. We need to spray our shoes with permethrin. I talk about that in the book. That's one of the most effective ways to fight off the ticks that are waiting on the brush that will climb up your pant leg or under your pants and bite you, often unbeknownst to you. Mm-hmm. It's a very effective and pretty safe method.
I don't know about in the US, but in the UK we can get clothes that are pre-soaked, that it's impregnated in.
Yes.
And so people are spending a lot of time outdoors. It's certainly worth looking into.
Very effective. And we also need to make that sort of clothing mandatory for people who work outside.
Yes.
For gardeners, for people who trim the bushes along the roads and under the power lines. Yeah. They need to be protected. Yeah. They also bring their clothing home and, ticks may be on it and expose their families. So that's a really effective method. And it has been made mandatory in some occupations in the Netherlands. I'd like to see that happen much more broadly across the EU and in the United States and everywhere.
Yeah, absolutely.
That this disease is moving to. I mean, it's in China, it's in Russia, it's in Australia, it's in South America, it's emerging there. It's been identified in a number of countries there. It's in Mexico and Turkey. I could go on.
Yeah. It'd be easier to say where it's not.
Yeah, it's a long list.
You've spent many years doing this. Do you have plans to continue your research? What's next?
Well, right now, and for the foreseeable future, I am going to be pushing this book.
Yep.
And I'm going to be pushing a message with this book. I have speeches prepared. I have one version of the speech for the Lyme community, the kind of inside baseball, we call it, view of Lyme disease for the people who have a grounding in it. And then I have another one for the more general public. Mm-hmm. And I will be taking that out there and delivering it. And I hope to get to the UK, by the way. If you know of any groups that might want to support this, that would be great. It's a way to bring attention to the issue, because everywhere I go, I meet with the press as well.
Yeah.
And the press covers my speech,
yep,
hopefully.
Yep.
But that's what I'll be doing for the foreseeable future. When that slows down, there's a lot of Lyme research that I would like to revisit. I'd like to see where the tests are. I'd like to look at what the best candidates are. Mm-hmm. And I can't say now what they are. I've done some reading on them, mm-hmm. but I don't say anything or write anything until I really have a good handle on the research. So I'd like to do that as one thing. And just keep, putting some articles out there. I am writing some articles for op-ed pages, the opinion pages of newspapers,
Yeah.
to, alert people to the book, but also to the threat. So that's what I'm doing. And you'll see those things on Twitter. I urge people to follow me on Twitter. That helps a great deal to get the message out. I'm at MaryBethPF is my handle. It's easy to find.
Brilliant.
Under my name as well.
Well, I just would like to thank you so much for your time. Is there anything you'd like to add before we finish today? Is there any takeaway message you want to leave our community with?
Well, one thing I would say is that children are the most frequently infected. Boys 5 to 9 are the single biggest group, but children overall are the population, because they play outside, that's most frequently infected. I have 4 grandchildren from 2 to 6 years old. I'm constantly hounding them to stay in the middle of the trail and telling their parents, check them tonight when you give them a bath. We need to protect them. And I want to do that. I want to help in that process. And I'm so grateful to the Lyme community for helping me do that. I have this army of people out there who are helping me, and I hope to help them as well. And I thank you too, Sarah.
Well, you already have helped us, and it's just wonderful that you're continuing to do so. And I agree that the important message of prevention, and particularly with children. We have a member who's a mother with children who are unwell, and she says that when we learnt the dangers of the sun and skin cancer, we didn't stop going outside. We simply took precautions. We wore sun cream, we wore hats, we wore long clothing, etc. And it's exactly the same with ticks. People go on holiday, and I'm sure it's the same in the US. People go over to Spain or wherever, and they pack their insect repellent. They don't think to do so when they're going out and about in the UK. And for anyone, most people listening to this, I think, will already understand the risks and understand the need for protection. But for anyone that isn't, we have a lot of information on our website for them. And for those people in our community that already know the risks, please do spread it to your friends and family. And if you're not already doing so, because I agree completely, prevention is, until we understand more, until we know how to deal with this properly, until the doctors, more importantly, know, prevention is so key, isn't it?
It really is. That's very well said.
Well, thank you so much for your time. It's an absolute pleasure to have you here. And we very much welcome you to the UK if you do come over to promote the book.
I did come over to do some research there and met with a Lyme group, and I look forward to coming back. Thank you.
Thank you. Thank you for your time. Bye-bye.
Okay.